I'm Shamila, the registered nurse from Infinity Care. I'm going to go through bowel care training. The outline of this training includes a learning objective, anatomy and physiology of the digestive system, bowel function, importance of bowel health, bowel dysfunction, bowel care demonstration, and escalation pathway. Upon completion of this training, you will be able to learn about the basic anatomy and physiology of the digestive system, learn factors that encourage and promote bowel health for people with disability, be familiar with commonly prescribed bowel care medications and their safe administration, identify common problems, and follow Infinity Care escalation pathway. So what is bowel care? Bowel care refers to the care and management of the process of elimination of fecal matter from the body. Bowel care can include personal hygiene, assistance with toileting, administrating of medications to promote bowel function. Basic anatomy and physiology of the digestive system. The digestive system includes mouth, where the food is broken down mechanically by chewing. Then it travels to the esophagus, a simple conduit between the mouth and the stomach. The stomach, where the action begins, digestion of protein initiated and food is reduced to liquid form. The liver, the center of metabolic activity in the body. Its major role in the digestive process is to provide bile salt to the small intestine, which are critical for digestion and absorption of fats. The pancreas provides a potent mixture of digestive enzymes to the small intestine, which are critical for the digestion of fat, carbohydrates, and protein. The small intestine, this is where the final stage of chemical enzymatic digestion occurs, where almost all nutrients are absorbed. Lastly, the large intestine is where water is absorbed, bacterial fermentation takes place, and feces are formed and excreted through the rectum. Bowel health. So bowel health is directly related to overall good health. Bowel motion can be time variable, so it can take up to 48 hours, which is considered normal. 72 hours is considered to be a little bit slow. Bowel health can be affected by many aspects of daily living, including a diet lacking in fiber, insufficient fluid intake, disruption to regular diet or routine, delaying bowel action due to pain such as from hemorrhoids, some medications, recent illnesses or hospitalization, low activity levels and reduced mobility, and reduced physical and emotional well-being. People with disabilities are at a higher risk of bowel dysfunctioning because of physical immobility, neurological injuries, or muscle weaknesses. Bowel health. When a person is experiencing problems with bowel functioning, you should understand the issue that's affecting bowel function, signs and symptoms of bowel problems, why you need to document bowel patterns to detect changes, and the importance of involving health professionals to assess the cause of bowel dysfunction, especially for people with complex health conditions. Bowel dysfunction. Bowel dysfunction is described as difficulty passing feces, or keeping feces contained in the bowel, or passing feces that is not considered to be normal consistency. The Bristol stool chart is used in the classification and documentations of feces. Please refer to the chart. Type 4 represents the ideal stool, which is formed and easy to pass. Bowel dysfunction can include constipation, which refers to difficulty passing feces. This can be caused by diet, pain, dehydration, immobility, pregnancies, or some medications. Diarrhea, which refers to frequent passing of loose, watery stools. Diarrhea can be caused by food poisoning, bowel infection, food allergies, medication, radiation therapies, and laxatives. Fecal incontinence is where uncontrolled passing of feces occur. Autonomic dysreflexia, which can be caused by spinal cord injury. Hemorrhoids, which is caused by swollen veins in the anus. Autonomic dysreflexia can also result in brain hemorrhage, seizure fits, arrhythmias, heart palpitations, and possibly death. Some of the signs and symptoms include sudden rise in blood pressure, severe pounding headache, flushing and blotching of the skin, excessive sweating, shortness of breath or anxiety, and chills without fever. Common causes of bowel dysfunctions can be either bladder related, which includes bladder distension or retention, blocked catheter, UTI, constipation, or inflamed hemorrhoids, or skin related, which can be caused by pressure sores, burns, ingrown toenails, and tight clothing, or other factors that includes fractures, kidney stones, labour, menstrual cramps, distended stomach. So what are the roles and responsibilities of a support worker? Offer privacy and develop a rapport with the participant when toileting or changing. Encourage fluid and nutritional intake. Follow procedures and care plans to promote continence. Assist client when transferring, ambulating, or walking to the toilet. Maximize mobility and exercise. Complete bowel record and report any concerns or changes to your manager. Recognize and report customer feedback and behaviours indicating discomfort. Report any signs or symptoms of bladder or bowel discomfort to your manager. Consent and sensitivity is an important part of the care we provide. Consent is an important and necessary part of good practice, and it is also the legal means by which the participant gives a valid authorization to care. You must obtain the consent of the participant. If the participant refuses to give consent, then the procedure should not be completed. You must notify Infinity Care if this occurs. In such cases, Infinity Care will liaise with the participant's representative. Where intimate procedures are required, be mindful of the participant's cultural and religious beliefs or restrictions that may prohibit this procedure being done by a member of the opposite sex. Assistance with toileting is another important part of our care. Some participants may need little to no assistance in going to the toilet, but may have difficulties in communicating their need to go to the toilet. Their care plan will document their way of letting you know. Some participants have poor bladder and bowel control and will have a program to be followed ensuring regular toilet regime. The level of assistance that a participant requires can vary from assisting with mobilizing or helping them on and off toilet or personal hygiene. It is important that you must always maintain the participant's dignity. Privacy must be respected at all times. We'll now cover digital stimulation. Digital stimulation is a manual rectal stimulation technique that is used to facilitate bowel motion by increasing muscular activity in the rectum, increasing rectal pressure, and relaxing the external anal sphincter. Digital rectal stimulation can be performed by gently inserting a gloved, lubricated finger through the anus into the rectal mucosa. Rotation is continued until wind or stool passes so the internal sphincter relaxes. In practice, digital stimulation can take 15 to 20 seconds. This is repeated until stool evacuation is completed. You must not be repeating this more than 3 times. We will now go through the digital stimulation procedure. Firstly, obtain a valid and informed consent. Ask the participant if they wish to use the toilet prior to undertaking the procedure. Ensure the bedpan, commode, toilet is readily available. Ensure that the bed is protected. Wash your hands and wear the appropriate PPE. Ensure the participant's privacy is maintained. Position the participant on their left side in a lateral position with their knees up towards their chest. This will aid to relax and minimize resistance and discomfort on insertion. The descending colon and rectum are positioned onto the left side of the body. Ask the participant to breathe deeply. Inform the client about the procedure. Apply the lubricant gel onto gloved fingers and the anus. Gently insert a single gloved finger into the rectum up to the second joint only. Turn the finger so that the padded area is in contact with the bowel wall throughout. Gently rotate in a clockwise direction 6 to 8 times for approximately 15 seconds or until a relaxation of the sphincter is felt. Observe the participant throughout the procedure. You will need to stop the procedure if the participant experiences discomfort, perianal area bleeding, requests to stop the procedure, or there is signs and symptoms of autonomic dysreflexia. Now gently remove your finger and await reflex evacuation of the stool. If reflex activity does not occur, repeat every 5 to 10 minutes until the rectum is emptied or activity ceases. Do not repeat more than 3 times if the reflex activity does not occur. When completed procedure, clean the perianal area. Dispose all equipments as per policy. Remove gloves, aprons, and wash your hands. The next topic is abdominal massage. Abdominal massage is reported to increase the frequency of bowel movement by stimulating movement of stool through the colon. Massage is gently applied to the abdomen following the length of the colon in a clockwise direction. Pressure is applied and released firmly but gently using the back or heel of the hand. Suppositories and enemas are widely used in bowel care. Enemas and suppositories may be prescribed to treat constipation or other medical conditions. These are commonly used, although glycerin suppositories are preferred. This can stimulate preserved reflex action and lubricate the stool. Small volume enemas, such as the microlax enemas, are commonly used. Conduct a per rectum assessment prior to inserting suppository or an enema to avoid insertion directly into feces and to ensure lubrication of the mucosa is maximized. Commonly used supplies for bowel care include a blowie, an apron, gloves, facial mask, skin wipes, lubricating gel, suppository, enema, and a wastage bag. I will now take you through administering suppositories and enemas procedure. An enema should not be given if the participant is allergic to any of the ingredients listed, out of date, package is torn, treating any other complaint unless prescribed by the doctor. When giving a suppository to a participant, the person administering the suppository must have fingernails that are natural and short. Suppositories should not be administered by anyone with long or artificial fingernails, as there is a risk of damage to the bowel, including rupture. Before you start the procedure, always obtain a valid consent. Ensure enema and suppository is in date. Give the participant the opportunity to urinate and assist as needed. Ensure the participant's privacy is maintained. Collect the necessary equipment. Wash your hands with soap and water and wear a disposable apron. Apply single-use disposable gloves. Assist the participant to lie on their left side with knees flexed, right leg higher, buttocks near the edge of the bed. Observe and examine the perianal area, observing skin integrity and any abnormalities which may require medical attention. Now you can open the suppository or enema packaging and lubricant gel. Lubricate the suppository or enema tip with the gel. Inform the participant that the procedure is about to commence. Separate the participant's buttocks and insert the suppository or enema into the rectum. Observe participant throughout the procedure and know when to stop. Once suppository and enema has been inserted, clean excess gel from the perianal area using a wet wipes. Make the participant comfortable and ask them to retain the suppository or enema for the time suggested by the manufacturer. Remove and appropriately dispose of any equipment, gloves and apron. Wash your hands post-procedures. The commonly prescribed bowel medications can include lactulose, Movicol, Metamucil, Senna, Coloxal, glycerol and Microlax enema. Here are some of the hints and tips for bowel care. It is very important for us to monitor and support our participants to maintain good bowel health. You are not required to diagnose health problems. However, you are required to monitor and report regularly on the health and well-being of the people you support, including the bowel health. What you can do to support the person to have a healthy bowel includes learning about the person's usual bowel habits so you can identify when there is a change. The Bistro chart above can also help you to know when medical intervention is required. Use the bowel chart to record when the person has a bowel motion and the Bistro chart to describe what the motion looks like. When the bowel chart shows the person's bowel habit has changed, always notify Infinity Care when there is a problem. As much as possible, talk to the person about the observed changes in the bowel habit in case there has been some variation in the person's circumstances that may explain the change. For example, new medication, different diet, or recent illness. So how do we escalate and report any concerns observed? Number 1, observe perianal area. Report to the Infinity Care manager if you have any of the following concerns: pressure area injury, poor skin integrity, anal bleeding, blood around the stool or problems with hemorrhoids, vomiting blood or fecal matter, diarrhea or vomiting that is more than one-off event, unusual pain before, during or after a bowel action, severe abdominal pain or vomiting along with constipation, sudden weight loss or constipation exceeding 7 days. If this was to occur, you are required to send an incident report and document your observation and concerns in the care note. The Infinity Manager will assess the severity and take appropriate actions. In the case of an emergency, the first response should always be contacting emergency services. Dial 000. However, for a non-emergency situation, it may be appropriate to contact a manager. With all high-intensity care, it is important to understand each participant is different and will require a personalized support. We will provide you with appropriate training and we will share the care plan before you start your service. Please seek help if you are uncomfortable with any of the process, and an Infinity Care nurse will guide you through the process. Remember, help is just a phone call away. Call 02 80 33 4582.